Welcome to another edition of Lincoln County School District's Compass Connection. I'm Kelly Beaudry, Special Programs Administrator, and I am here today with one of our wonderful community partners. This is Sena Benson-Arb, and she is a clinical supervisor of the Child and Family Team at Lincoln County Behavioral Health. And so, first of all, Sena, why don't we just start by learning a little more about you and what you do?
Thanks, Kelly. I have been with behavioral health at the county for 24 years. So I've grown up there, I guess. I've served on all of the adult teams and done crisis work. I think the county offers a lot of opportunities to gain skills in a lot of areas, but my passion's always been with child and family. So I landed there and was promoted to the clinical supervisor position about 4.5 years ago.
And so tell us a little bit about what Lincoln County Behavioral Health Child and Family Services do for children and families in our community.
You bet. Primarily we serve Oregon Health Plan members. We also serve children ages 0 to about 22. We do have one program that's very specific that serves that kind of transitional age group up to 25. Outpatient services, intensive outpatient services, specialized programs. We have wraparound with care coordinators facilitating those meetings of teens. We kind of serve whoever in the community is looking for mental health counseling and their families.
That's so good to hear because, we hear a lot nowadays that there's just a shortage of mental health providers. And so, I know while that is a challenge, at the same time, if people want to seek out help, how do they go about finding you?
Absolutely, easy peasy. Call 541-265-4179. We'll set up an intake screen and an assessment will be scheduled from there, and then we can discuss with the youth or family kind of what the needs might be and how we could meet those.
Excellent. Okay, well, the topic of our chat this morning is for us to talk a little bit about the partnership that we have developed over the last several years here in the school district with Lincoln County Behavioral Health. And so let's start by talking about what we've done together to kind of update and really improve our school-based suicide intervention process. So that kind of started with the whole screener process. Can you talk a little bit about what we do now in collaboration with each other with that screening?
Absolutely. All of the counselors in the schools have been trained to provide a Columbia assessment, which does screen out level of risk for suicide for youth. The partnership, I think, that has really been great to see grow too is our mobile crisis is able to come to the school and meet children, families here, speak with the counselor, collaborate on some safety plans. I think the other thing that came from that felt so supportive was if a youth has had a crisis event, we now have a process in place where we can share the safety plan with school staff. And if the student returns to school the next day, staff at schools have facilitated a meeting so that we can do a follow-up, make sure that all of the safety plans are in place and working. So that feels great.
Yeah, no, I agree. That reentry process has been really greatly improved over the last few years so that, we can welcome a student back knowing that they are struggling, but also provide a place for them to receive a phone call the next day, set up a meeting to determine what those safety needs at school are.
Yes, just having the awareness too of maybe a little extra support needed that day. I think that's been, I think the spirit behind that has been all around kind of safety and support, and that's worked out nicely.
So you talked a little bit about training with the Columbia screener. What other kinds of training have you helped to provide with school staff and counselors in particular? We look to you for some training, so do you want to talk a bit about what you provide?
Well, I'll take you up on any invitations. We do provide through our prevention and public health folks. We have QPR, which is kind of an inquiry youth can also use with peers, just to ask a few more questions around maybe hopelessness or suicidal thoughts, and then how to respond, of course. Their prevention work is definitely present in the schools. I am also aware the juvenile department is doing some prevention work in the schools too, some harm reduction work, and I think that partnership has been really vital too.
And then most recently, especially in this last school year, we've really intensified our partnership around a program called Dialectical Behavioral Therapy and the skills training part of that. So tell us a little bit about DBT, and then we'll talk about what we're doing in the schools with that.
You bet. This has been really an exciting, I think, kind of organic process that's grown into something wonderful. I had the privilege of being intensively trained in dialectical behavioral therapy, which addresses emotion dysregulation. We teach emotion regulation skills, the ability to kind of tolerate distress when situations occur that you can't change. Interpersonal skills, which being able to effectively communicate, ask for what you want or need, or decline things you don't want to do. And all of those skills together, I think, give kids a really great toolkit and a lot of coping strategies. I know I use the skills all the time.
So the dialectical behavioral therapy, the skills portion of it, that's what we've really been developing as a small group intervention with students at our secondary schools. So this year you have been working with your QMHAs. Tell me what that means.
Qualified Mental Health Associate.
Okay, so our QMHAs, the Qualified Mental Health Associates, have been partnering with our school staff, either our health service advocates or our school counselors, and they've been co-facilitating that series of group skill building lessons in our schools.
Yes.
So why don't you talk a little bit about the training and how we've developed those plans?
Great. Yes, I was invited to provide some training for the school counselors and the health service advocates. Our QMHAs, our care coordinators, all had training prior. And so partnering up to do kind of the shadowing and co-facilitating, I think, has grown with the benefit of having lesson plans each week, planned activities each week to really keep things engaging. And it certainly has grown.
It has. We started, let's see, last year you had a group that we didn't co-facilitate. And then once we've started co-facilitating these groups, I think this year at our secondary schools, we've served almost 100 students in all of the groups that we've run across the district.
That's
so
fabulous. I know
that's
our
been
goal
really
is
exciting.
80, so I'm
I
just
think that's been
delighted
really
to
exciting.
hear. I'm also hearing kind of word of mouth of some of the students who have enjoyed and benefited from the group, telling other friends about it. So hopefully those referrals will.
Yes,
Yeah.
absolutely. So I guess that would be kind of the final question is like, what's our next steps? Continuing to develop that so that we can reach more students. That's really focused at the secondary level. What about younger kiddos?
Oh, I totally believe that. Well, I even think the lesson plans could be modified to reach younger age students. Definitely the skills, I wished I would have had them maybe in 3rd or 4th grade instead of waiting till I was 40 something. So yes, getting into the elementary schools, partnering with those staff members who would be interested and have a passion for it, I think would be great to see.
And possibly even, we've talked about, and we haven't developed it yet, but possibly even partnering with like some parent group work, helping parents to develop those skills to work with their kids at a younger elementary age.
And that would be my greatest wish.
Yeah.
We do know that the outcomes when we can support parents to support coaching the skills with their children is really the best outcomes.
Well, I'm looking forward to seeing what we develop next, and it's been really great working with you, so thanks for your partnership, and as always, we appreciate you being here and sharing your knowledge with us.
Well, and thank you for all the learning you've afforded me.
Yep. So stay tuned next week for another edition of the Compass Connection. Thanks for watching.